Hey everyone, Dr. Ahmed Ergin here, your diabetes specialist, hormone specialist in Port St. Lucie, Florida. Today we are talking about diabetic kidney health without beating around the bush or turning into kind of some sort of TV show. Just clinical wisdom for you, clear facts, and some gentle encouragement as well. So CKD we call it, right? Chronic kidney disease. There's a lot of confusion around it. Doctors sometimes overstate it, sometimes don't even mention it, sometimes understate it. And there's a lack of information among some doctors, but definitely among patients. Patients are totally confused what it really means. Now, it is a slow leak, okay? Your kidneys lose filtering capacity over time. So that number doctors focus on is eGFR, glomerular filtration rate. So that is how much your kidneys filter per minute. Generally declines around 1 ml per minute each year after age 40. So even if you had no insult to your kidneys whatsoever, you will lose 1 milliliter or 1 GFR per year after age 40. So if you have diabetes, that may be 2 to 3, all right, or uncontrolled diabetes. So that aging alone is not a disease. So assume you're 90 years old and your GFR was 100 when you were younger. Now you're down to 60. That's not necessarily chronic kidney disease. Yes, GFR is declined. You can call it, they don't call it anything right now. They will still call it a CKD, but it's not a disease. It's just related to aging. High blood sugar, as you know, damages tiny filters in your kidneys, and those broken filters let protein slip into your urine called proteinuria or albuminuria. And that's a big, big red flag. By the way, I apologize for the sty in my eye. I don't know how it happened, but working with it. It's going to go away by tomorrow, possibly. Anyway, let's go back to your GFR. Even if your GFR is decent, say 80 or 90, if albumin is elevated, okay, in your urine, that still qualifies as early stage CKD. Why? Because you should not have any protein in your urine whatsoever if your kidneys are structurally sound. And that's why good numbers don't always mean good function. Because, actually in the early stages of kidney disease, sometimes there's a phenomenon we call hyperfiltration, meaning that your GFR actually may go high for compensation for the deficit from the dying kidney cells. So if your GFR is like, say, 120, 130, don't be so happy. That means your kidneys are overworking. They start doing overtime and they're going to start failing. So what are the mechanisms behind the decline? It's not just sugar burning out your kidneys. It is also oxidative stress, like chronic inflammation, high glomerular pressure that happens as a result of insulin resistance, but also high blood pressure itself as well. And gut-derived toxins. What does that mean? The intestinal system also has to work very well. When you have a leaky gut, you leak a lot of lipopolysaccharides, which are some bacteria products. Basically, they are toxins that leak into your system and damages your kidneys, for example. And there's a lot of insulin-related metabolic effects that affects your kidneys. So knowing this, doctors and pharmaceutical companies came up with some medications, and I'm going to tell them what they do and what they are and what not, but I'm going to also tell you how to naturally achieve similar results or additional results. I'm not saying don't take your medicines. I'm saying, be aware of all the other natural stuff out there that has probably never mentioned to you. So for example, ACE inhibitors or ARBs, we call them. Most common ACE inhibitor people are using lisinopril and enalapril. And ARBs are most common is like losartan and valsartan. So they are helpful to reduce that pressure inside the kidney filter. Remember, too much pressure is not good for your kidneys. Now we have also SGLT2 inhibitors, which lower the hyperfiltration and again, protect kidney cells. They are also good for lowering protein in the urine. They're also good at giving you urinary tract infections, in some cases sepsis. So you better keep it clean down there because sugar attracts the bacteria and fungus, and that's not going to be a good party at the end of the day when all the bad guys show up. And then there's another medication called finerenone, and that is Kerendia in brand name. And for SGLT2 inhibitors, forgot to tell you the brand names so that you know if you're on it or not. Jardiance, Farxiga, Invokana, etc. And finerenone is Kerendia. It's a totally different mechanism of action. It is just targeting with only one receptor that reduces inflammation, and that's a mineralocorticoid receptor. and that's overactivated in patients with diabetic kidney disease. So finerenone does that with a price tag of $600 only. Yeah. So anyway, let's talk about natural allies here that actually work. Okay, and they're not $600 either. And there are a number of clinically studied natural compounds that work on the same physiological targets as many of the drugs that we prescribe today to slow down the kidney disease progression. So what's the key difference? Well, the natural stuff tend to come with a lot less side effects, and they support multiple organ systems, not just kidneys, and offer long-term health synergy rather than just symptom management or just hitting one receptor at a time, etc. Let's unpack these one by one. So berberine, right? And a lot of people compare berberine to metformin. And why? Because they're very similar. So berberine is a metabolic master switch. What does that mean? I'll tell you in a minute. But berberine is really an alkaloid. It found in herbs like golden seal and barberry. What makes it impressive in CKD that it is ability to activate that AMP kinase. That is the one that I was telling you about, the cellular energy switch. Okay. Now, also reduces insulin resistance, right? Berberine reduces insulin resistance. That's why a lot of people are using it for lowering fasting glucose levels. So having said that, these things don't work overnight. A lot of people, let's say they buy our SugarMD Super Berberine or SugarMD Berberine, the regular Berberine. They say, I started taking it 2 days ago. My numbers are still high. Well, it doesn't work that way, buddy. So these are lifestyle changes. They are supplements. They need to take their time to get the job done. And then if you're popping pills and eating your dessert at night, that's not happening either, right? So we have to have common sense instead of expecting miracles from these natural things. The berberine suppresses the inflammation by downregulating NF-kappa beta, TNF-alpha, which are key inflammatory players in that what we call glomerular injury in kidneys. Now, it also lowers cholesterol levels, which further reduces endothelial stress and slows atherosclerosis, which is another hit to kidneys in diabetics. Now, in animal models, berberine also reduces glomerular hypertrophy and fibrosis, which happens as a result of overworking and inflammation. And that mimics some of the protective effects we see with ACE inhibitors like lisinopril and enalapril. It's basically a great functional medicine tool, the berberine is, and that hits multiple CKD-related targets, metabolic, inflammatory, structural, etc. Versus metformin does, in a way, similar things, but also causes a lot of damage. So that's going to be up to you and your doctor how to go. If your doctor is not a functional medicine doctor, they will have no idea what berberine is, so don't even mention. But anyway, the next thing is omega-3 fatty acids. A lot of us actually are deficient in omega-3 fatty acids. There is a test for that actually to find out how deficient you are, and that's called omega-3 index. I would recommend that to everyone. Insurance may not cover it, but guess what? It's your health. Invest in a little bit. So podocyte protectors, right? So podocytes are that little like structural columns on your kidney that, don't let any leak and anything like that. But particularly EPA and DHA among the omega-3 fatty acids are known for not only for cardiovascular benefits, but they also are equally great for kidney protection. These fatty acids really stabilize that podocyte membranes and any membrane in the body in that regard. And they are also helping protect the glomerular filtration barrier with that EPA and DHA. If you're buying a EPA and DHA or omega-3 supplement, make sure you have at least 1,000 to 2,000 of omega-3 fatty acids, which are EPA and DHA, because there are a lot of cheap stuff that I see out there. They only have a few hundred milligram and they call it a day, and and people buy it because they're cheap. Now, we need to suppress systemic inflammation, right? We need to reduce that cytokine storm, we call it. A lot of cytokines are bad for you that can accelerate that nephron, which are the kidney cell damage. So omega-3s are also shown to reduce urinary albumin excretion in both type 1 and type 2 diabetic patients. They can lower blood pressure slightly, especially in salt-sensitive individuals. Omega-3s are one of the few natural compounds with solid clinical data supporting their use in that kidney disease progression. Next one is called cordyceps sinensis. So this is kidney's mitochondrial ally. Mitochondria are the organelles in your cells that keep the energy going. Without energy, you got nothing. That means you're dead. When your cells don't have energy, that means they are dead. So part of you is dead in that case. Cordyceps is a medicinal mushroom, right? Used in traditional Chinese medicine, now gaining traction in nephrology, especially in the research area. Now, what does it do? It boosts the ATP production in kidney cells. So if you don't have a lot of kidney cells left, you might as well want the rest of them work pretty good, right? Because if they don't have enough energy, they will also die, and your metabolism in the kidneys will be impaired. And it will prevent the apoptosis, which is the cell death in your tubular cells, which are the part of the nephron that after the glomeruli, where the blood is filtered, and tubular section of the nephrons are where we reabsorb important nutrients, including protein, etc. So as a result, the cordyceps reduces proteinuria and creatinine levels in blood as well in some small trials. Now, it also protects against drug-induced nephrotoxicity, meaning kidney damage or kidney toxicity, which happens a lot with a lot of drugs like, pantoprazole or proton pump inhibitors that a lot of people are using for their stomach acid. NSAIDs like Advil or Aleve, people are popping them up like as if they're candies. And they are really bad for your kidneys. They're toxic. It is a smart option for patients who have early mitochondrial dysfunction. Especially, you will know how you have mitochondrial dysfunction by asking yourself, hey, do I have fatigue? Do I have brain fog, etc.? These are signs of mitochondrial dysfunction in your entire body. And if you have statin sensitivity, that's another sign that you have mitochondrial dysfunction. So the next in line is going to be quercetin. That is a silent anti-inflammatory. It is a flavonoid found in your onions, your apples, your green tea that I'm sure you're having every day, right? And they deserve a lot of attention when it comes to kidney health. So what do? Well, quercetin, especially here, is good at inhibiting advanced glycation end products. If you know what that means, I have discussed it in other videos. So if you watch my other videos, you probably know this as well. But in summary, these are products of like glucose and protein coming together and creating damage and aging you. That's the name actually matches the function here. Ages, advanced glycation end products. They're notorious for damaging kidney capillaries in diabetics. And quercetin also blocks TGF-beta, which is the main cytokine, guys, driving fibrosis and scarring in your kidneys. And quercetin is a strong antioxidant, helping mop up those free radicals in overactive immune responses. Let's say, you have autoimmune disease like Hashimoto's, lupus, rheumatoid arthritis, even vitiligo or stuff like that. Any autoimmune disease, your kidneys are a potential target for people with autoimmune diseases. But emerging data suggests that it may improve insulin signaling endothelial function, which is your cells lining your arteries. So in many ways, quercetin offers the anti-inflammatory and anti-fibrotic benefits of similar to finerenone, which is Kerendia, without the prescription. The next is astragalus root. This is a time-tested nephrotonic, we call it. In traditional Chinese medicine, they use it a lot. Astragalus is also getting a lot of attention now because it has been shown to lower serum creatinine and increase the creatinine clearance in CKD patients and reduces urinary protein excretion significantly in clinical trials and may help regulate klotho, which is an anti-aging gene that protects kidney tissue and slows down that chronic kidney disease progression. It also works as a mild immunomodulator, reducing the inflammatory overdrive without suppressing the immunity, right? That's a key factor, which a lot of like anti-rejection drugs or anti-inflammatory prednisone, steroid, etc., they suppress your entire immune system, which is not cool. It is ideal. It can be used as a long-term herb for patients with early CKD who want to maintain GFR and avoid the fibrosis. Next one is you're more familiar with coenzyme Q10, right? Or CoQ10 we call it. So mitochondrial maintenance is important with CoQ10 is really important there for being a fat-soluble antioxidant and a cofactor in the mitochondrial energy production. Again, remember we talked about mitochondria being very important, the entire body, but also especially in kidneys because kidneys work very hard. So Kidneys are really dense in the mitochondria, okay? Especially in the proximal tubule. Sorry, I'm using a lot of like medical jargon here, but I feel like without it, it's kind of hard to explain. But proximal tubule is the initial part of the tubular structure in the nephrons that allows the reabsorption of vital nutrients. So CoQ10 improves the mitochondrial respiration, which helps the cells survive in low oxygen states. Reduces oxidative stress, one of the root cause, again, we talked about as the cause of glomerulosclerosis. And some studies show lowered creatinine and improved symptoms of fatigue in CKD patients. So another cool addition to your regimen, right? It supports cardiovascular function and is critical in preventing heart-kidney domino effect. Sometimes that happens when you have kidney disease, you end up with the heart disease because they kind of are active tissues with similarly high demand for mitochondria. So a great adjunct really is for diabetic patients, especially if they are on, statins, which deplete CoQ10 levels like severely. Next one, remember we talked about gut being so important and leaky gut being bad, right? So what we call is a gut-kidney axis. It's like a little highway between gut and kidneys. So this is a game changer. Why? Because your gut bacteria play a massive role in your kidney health. So here's how. Poor gut health allows the bacterial metabolites like indoxyl sulfate and some other toxins to basically affect your kidneys. Probiotics, which are the live bacteria, can bind or metabolize these compounds in the gut, preventing them from entering the bloodstream to begin with. These probiotics also help lower the systemic inflammation. They're going to help with the bowel regularity because if you're constipated, you're allowing toxins to leak into your system more because that shit is staying there too long, right? And that's not good. And in studies, certain strains like especially lactobacillus and bifidobacterium reduce the uremic toxin load. Uremia is something that happens when your kidneys are not working because as a primary function of kidneys is removing that uric acid protein breakdown product. But these bacteria reduce that uremic toxin load and improve the quality of life in CKD patients. So if you have got bloating, constipation, or you have been on antibiotics recently, which kills all the good bacteria as well, this is a no-brainer add-on, okay? Next one is my favorite, is taurine. That's overlooked. A lot of people don't know about it. It's an osmolyte. It's an antioxidant. It is conditionally an essential amino acid involved in fluid regulation, electrolyte balance, and cell protection. It stabilizes cell membranes in high glucose environments, reducing damage in the kidney tubules. It actually acts as a calcium and sodium buffer to protect against that swelling and necrosis. Now, it's a strong antioxidant as well, an anti-inflammatory, so it's really relevant in that diabetes-related oxidative overload. Now, in animal models, taurine show to reduce protein in the urine, preserve the kidney structure, and improve the kidney oxygenation. It is especially important in diabetics with high blood pressure, kidney disease, or heart problems if they have all these going together because it supports all three systems. Bottom line, these compounds don't just support kidney function, they engage with the exact mechanisms that we target pharmacologically. They are multi-hit nutrients, right? They're working on inflammation, oxidative stress, mitochondrial health, endothelial function, glomerular integrity, etc., etc. Now, combined with lifestyle changes and conventional therapies, they can be the difference really between that stable CKD or rapid progression to dialysis. And in some cases, even partial reversal of early stage kidney damage. Now, what are the lifestyle fundamentals? We got to reduce the sodium, right? That helps reduce protein in the urine and blood pressure as anyway. And we need to do a moderate protein intake. We don't want to do too little or too much of a protein for our kidneys if you have kidney disease. And plant-based diet is going to work the best. Mediterranean-style diet, rich in fiber and antioxidant, will be great for your kidneys. We need to exercise daily, manage the blood sugar tightly. The least minimum, I guess, the bare minimum, I would say, will be less than 130 fasting. If you prefer it less than 120, 110, or even 100. And definitely don't go over 180 after meals. That's where damage really happens. So hydration, you want to have clear, but not colorless hydration, that when you look at your urine color, it should not be dark. Let's talk quickly about the SugarMD kidney support. A lot of you are asking, what is this and how does it help? It is basically a premium formula that doesn't contain the herbs like astragalus or berberine because they need to be used on their own since they require high dose and you cannot put them all together in 1 or 2 pill. But instead, the SugarMD kidney support to have the strength that lies in targeted vitamins, antioxidants, and probiotics, which we talked about. Your kidneys are in need of B2, B5, B6, vitamin C, folate, biotin, vitamin D, alpha-lipoic acid, benfotiamine, etc. And obviously, we talked about probiotics like bifidobacterium, etc. So these are important ingredients in SugarMD kidney support, which works as a cellular antioxidant defense and protect your even nerve and even vascular function because of the benfotiamine and alpha-lipoic acid in there as well. It reduces your inflammation and importantly help optimize your gut-kidney axis by reducing the toxin load with the probiotics in there. So let's go back to a little bit about why that matters with the benfotiamine and alpha-lipoic acid, because they reduce the advanced glycation, which is, remember, the advanced glycation end product we talked about as a result of oxidative damage. These are key drivers of microvascular, tiny vessel injury in diabetic kidneys. Vitamin D helps modulate the renin-angiotensin system, which is, what controls the glomerular or intraglomerular pressure, or to be more easier language, I would say the blood pressure in your tiny kidney arteries. And B vitamins in there support the homocysteine metabolism, which is important. It helps with the neurotransmission and cellular repair as well. And as I said, lactobacillus, etc., bifidobacterium removes harmful metabolites that contribute to kidney inflammation and fibrosis. Now, you can also incorporate taurine, which is separate from the supplement we have, but that also can further support renal protection through that antioxidant and osmolyte action we talked about. So what to do with all this information? All right, so let's have an actionable plan. So number 1, we are going to track our labs. Every 3 to 6 months, we're going to look at GFR, urine albumin, serum creatinine, BUN. We're going to look at inflammatory markers like CRP, TNF-alpha if available, and vitamin D levels, and you need to optimize the vitamin D levels. And we're going to pay attention to our lifestyle and diet, stay hydrated. We're going to reduce sodium. We're going to moderate protein intake and follow a plant-first, fiber-rich diet and move daily, right? And when it comes to supplement strategy, you can use all the herbs we talked about. You can use SugarMD kidney support once a day. And one of my favorite, like you mentioned, is taurine, around 1,000 milligrams a day if there's no contraindication, because it's also helpful for blood pressure if you have high blood pressure, a little bit over 120/70. And like I said, start or continue proven compounds like berberine, omega-3s, quercetin, astragalus, cordyceps, right? We talked about all of that. So you can combine these with your prescribed medications. So I'm not saying stop your ACE inhibitors or SGLT2 inhibitors or Kerendia and whatnot, unless you cannot afford them. Like sometimes SGLT2 inhibitors like Jardiance and Farxiga and Kerendia can be expensive. Your insurance may not cover it. But then at least you have some natural alternatives if you're not able to afford those medications. So what you're doing here is basically layering the support using natural allies to amplify the protection. And here's my final take for you, and that's a real talk. Diabetic kidney disease is not static, okay? It can be slowed, even partially reversed, especially when caught early. Your kidneys are pretty resilient if you give them the right tools, right? So clinical meds or medications, they reduce the pressure and inflammation, and there are proven supplements and nutrients that mimic those pathways. So smart lifestyle measures and gut-kidney support with probiotics and taurine, that is the real strategy. Now, SugarMD kidney support also play a valuable role in the founding tier, but you will often need other targeted herbal metabolic compounds alongside with it. So stay persistent, track labs, adjust as you go, and remember, CKD is negotiable, not inevitable. I'm Dr. Ergin from Diabetes, Thyroid, and Hormone Center of the Treasure Coast in Port St. Lucie, Florida. See you next time.